Well, a new coronavirus variant is causing an increased number of COVID cases in the country, according to the Centers for Disease Control and Prevention. It's called EG5, and it's another Omicron offshoot. As we head into the fall and winter months, experts are predicting there will be a rise in COVID and other respiratory illnesses as well. And that is why they are urging everyone who are eligible to get vaccinated against COVID-19, RSV, and the flu once those shots do become available. The updated COVID shot is expected in the fall, and experts say it should provide protection against the EG5 strain. Joining us now to talk more about this is emergency medical physician and medical doctor, Dr. Richina Bicette-McCain. Doctor, thank you for being here. In your opinion, what is the best way to fight against these illnesses as well as COVID-19?
I definitely think the best way to fight against COVID-19 is to get vaccinated. We are seeing a lot of widespread protection in this country, either from people who have been vaccinated and boosted or people who have gotten one or more primary infections. But coronavirus continues to evolve, it continues to change. And as these new strains appear, the number one tenet to prevention and to maintaining your health is definitely vaccination.
So what is one thing you wish people knew about COVID and its impact that maybe we don't?
Well, I think there still is a lot of vaccine hesitancy. There's still a lot of misinformation. Getting the coronavirus vaccine cannot give you COVID. And just because you are young and healthy does not mean that you are not at risk of severe COVID. There's also been a lot more studies and research done recently in terms of long-term COVID and the kind of symptoms that those can convey. This is not the cold of the 1960s that you have for 3 days and get better and you have no symptoms again. There are people suffering with long-term heart issues, long-term neurological issues, and long-term respiratory issues from this.
And how can we stay healthy while awaiting an updated vaccine?
Well, although it's hot as all can be outside, the best thing to do is try to be in well-ventilated areas, outdoors. If you have to be in a large room full of crowded people, you have to weigh the risks and benefits to you. Are you immunocompromised or are you an older adult? If so, you may decide to wear a mask in those situations. And although we're waiting for the updated booster to come in the fall, if you are at particularly high risk and you have not been vaccinated, it may be better for you to just go ahead and get vaccinated now.
All right, so we have some new research as well. If you're pregnant and questioning whether or not you should receive a COVID vaccine, there's some new research out. A new study published in the journal Vaccine found that COVID vaccines and boosters administered to pregnant women benefited both the mother and child. And they say COVID vaccination is safe during pregnancy and encouraged because women are more at risk for complications if they contract COVID. So, doctor, what kinds of complications can impact a pregnant woman who catches the coronavirus?
You know, I'm glad you brought this up because I think this particular study, although it was on a smaller scale, is reiterating what we already knew. Pregnancy in and of itself is a risk factor for developing severe COVID. Pregnant women who have contracted COVID, studies have shown, have longer hospital courses. They're at higher risk of respiratory distress or needing mechanical ventilation or a tracheostomy. They're at risk of having stillbirth and, of course, at risk of death. So the fact that we know that these vaccines are safe in pregnancy, and we know that the antibodies are transferring from mother to child to protect the newborn infant, all around, it's just a good idea that if you are pregnant or thinking of getting pregnant, please get vaccinated.
And what would you say to moms who are still on the fence about getting their booster this fall?
I think an ounce of prevention is worth a pound of cure. You don't want to be the mom that hesitated about getting a vaccine that we know is safe in pregnancy, and then for whatever reason, you end up having complications, or your newborn is born not protected from COVID and they contract the virus and have complications as well. There aren't any vaccines that are approved for infants under 6 months of age. So this is really the best way to protect your baby.
And we have about a minute left, but if a mother is boosted while breastfeeding, will the child also be protected, or is the protection only if a mom is vaccinated while the baby is in utero?
Well, there's still more studies to be done on what the antibody levels in breast milk are. We do know that the antibodies cross the placenta, so while the mom is pregnant, those antibodies antibodies will be transferred, but we can't yet say the same for moms who are breastfeeding.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.